So guys, today we're going to begin with Paola, then we will continue with Mariana Saquines. Right after we will have Marcela Guzman, then Danita Zambrana, and the last one would be Bernardo Cuba. Okay, so let's get started with you, Paola. Before you all leave our main session, let me remind you that you all have to join at the end of the meeting so we can have our survey, please. Okay. So I'll see you at the end of the class. Hey Paola, how are you doing?
Hello.
So how have you been?
Nice.
Okay, so yesterday we were talking about, oh, well, first give me 1 second. Okay, from now on we have 15 minutes. So, what could you tell me about ultrasound? Is there anything you might be having problems with or doubts about this kind of imaging study?
Yeah. I would you explain me the topic that I saw yesterday, please? Because I think that this topic is very complicated to me because I don't I don't know this topic. But it's very interesting for me. I I know the ultrasound scan, right? My father explained me that ultrasound scan is it's a medical test that
Mhm.
use high frequency
High frequency.
frequency sounds waves to capture live images from the inside or of our body. And I like to learn a lot of the rayos X.
X-rays?
The difference or the new investigations about rayos X or ultrasound. It's very interesting, and I would like investigate a lot the ultrasound in embryology, like when a woman is pregnant. It will be very interesting, the ultrasound.
Okay, so you mean in obstetrics, right?
Yeah.
Okay, so you want me to explain a little bit about the difference between those two imaging
Okay,
studies, right?
I would like to learn.
Okay, so when is your dad a doctor?
Yeah, it's a
Oh,
doctor, and it's very important to me learn these topics.
okay, great. So your dad, as your dad was telling you, the this ultrasound imaging is actually based on, as your dad told you, higher frequency waves. Okay, those waves cannot be heard. You cannot hear those waves because they have a different wave length. Do you know
Sorry,
what you?
I I I have a questions about these waves. Okay,
Okay,
in the frequency in the ultrasound of obstetric, right?
okay,
Uh, how have the waves in interactua? Or I was in
interact.
yeah with the heart of the baby, or how I don't know. I would like to learn how work the waves in a
Okay.
baby, in a heart of a baby, in a woman. I
Okay.
would like to learn.
Okay. So, as well, the main point is that this equipment sends high frequency waves. Okay, and they are harmless. They do not cause any kind of harm. Okay, they do not hurt the baby. They do not hurt any kind of structure, neither the baby nor the mother, as you want to talk about obstetrics, right? So they are harmless. They do not hurt the baby, and neither the mother, any kind of structure. Okay. So what is this all based on? Is that these waves are sent by this part of the equipment that is called the transducer. In Spanish would be transductor, right? So this part of the equipment sends or shoots these waves, and they bounce. Do you know what bounce is?
No.
Okay, bounce means in
Sondas?
no, actually bounce means rebotar.
Ah,
Rebotar.
yeah.
Okay, so those waves, those high frequency waves, are sent into a structure, and depending on how stiff they are, they bounce back into the transducer. Do you get it?
Yeah, I get it.
Okay, so they bounce back into the transducer and go through a lot of devices into this equipment, and you get an image. It's like an echo.
Okay.
It's like when you shout and you have a wall in front of you,
Yeah.
this sound bounces right back to you, right? So
Mm.
that is how these waves reach the structures, any kind of structure, as you just said, the baby's structure, or any kind of structure according to the mother, right? So they bounce back into the transducer, and they go through, I don't know what the process is, because that is a whole different area. However, what we do have to know is that we get an image from an echo that is sent
Yeah.
through these waves and bounce back into the transducer, and you get an image of
Yeah. My father tell me that echoes are then reflect back
yeah.
into a computer, right?
Great, yes, that is how it works.
Ah, yeah.
Okay,
Okay.
so those waves are not hurtful. They do not harm the baby. Okay, so we actually have different types of obstetrics modalities on ultrasound,
Yeah.
because we have, for example, an structural ultrasound. This structural ultrasound, that is according to the obstetrics part, right, is like we define how well the organs are developing inside the baby's body. For example, I guess it is on the 20th week, we can see
Mhm.
the heartbeat of the baby. So as you know that well, in newborns, in babies that had recently been born, right, they are 80% water.
Mhm.
So right before that, it is even higher, the percentage of water that a baby or a fetus actually is made of. So those structures that are mostly water inside the uterus do not um, make those wave sounds, those ultrasound waves. They do not, it's like they do not find a barrier, a wall they hit into. They have soft tissues because their
Yeah.
baby fetus are mostly made of water, right? So we can see through the chest of the baby, and we can actually can see the heart beating uh, in an image. So it's a whole, how do I say this? A study that happens in real time. So we can see actually in the moment you are using the transducer, we can see how the structures are moving inside a person's body because it's in real time. So, do you have any other doubts? Well, the main
Yeah.
difference between the X-rays and the ultrasound is like the X-rays use ionizing radiation, which actually
Yeah.
is harmful, right? Okay, when we get a lot of X-rays or a personal trainer, a personal who is well has the job of taking these X-rays is always exposed to a dose of ionizing radiation. That is why he or she protects his own body with this. Have you ever seen those like clothes that have this kind of metal so they do not get harmed by the ionizing radiation?
Okay, I understand that X-rays it's for bones or any organs, and ultrasound is like I feel that is so close to a pregnant woman. Uh, X-rays is like I think that it's like close to a disease or see any organ or bone.
Okay, so actually we get I'm going give me 1 second. I'm going to start sharing my screen with you because we
Okay.
have um we well when we use x-rays, we're not just talking about bones. We get a lot of densities actually. Uh,
Okay.
so
Yeah.
X-rays are not only used for well to see bones. We can use X-rays to see some other structures. Uh, okay, give me 1 second.
The X-rays work to like take ¿cómo se dice? I don't know. It's like a when a person it's have a disease. I think that X-rays take it's like a note. Carry the information about this person and shows in a computer or a paper that the human how I don't know the how work these X-rays in a human.
Okay, we actually, it's like this X-ray machine shoots X-rays. This ray is actually, there's
Yeah.
like beams, actually. It's not waves like in the ultrasound. These are beams, actually. In Spanish would be
Mm-hmm.
rayos, right? So,
Yes.
and this equipment shoots these beams and they are really, really powerful. They can go through almost any kind of structure. Okay, so a human body would not represent a major effort to go through
Okay.
for the x-rays. So you're seeing my screen, right?
Yes.
Okay, so here, depending on what any tissue is made of, we get a lot of different densities in our x-rays. So we have this like white part in the
Yeah.
middle that would be close to the color of bones. On your left, you can read fluid and soft tissue. It is also seen white, right? But it is darker than bone. So we also can see air when it gets even darker than fluid and soft tissue.
Yeah.
And when we see metal, for example, I have one metal piece in my hand because I fractured one of my bones in my
Yeah.
hand, and we would see it really, really white, right? So when we use X-rays, we do not only see bones. We
Mm-hmm.
can see a lot of structures. For example, here we can see the heart, which is not bone. And if you compare this color of the heart,
In the X-rays
yeah,
has in the X-rays have lubricating too, equal the ultrasound or no?
no, not really.
Oh, okay.
It shoots actually from let's say a moderate distance between the device, the equipment, and the person. It is not
Okay.
uh, in any case they touch themselves. There is no contact between the equipment and the person. It only
Okay.
shoots and go through
Yeah.
the air and go through the the body, go through
Okay.
the patient's body. And on the other side, we have a different kind of material in which we have like a photograph of the inside of the body. So this kind of material is called actually a plaque, right? So on the other side of the person's body, we have the equipment that shoots the X-ray beams, and on the other side we have the plaque, in which these beams are going to reflect, and they're going to be like a photograph.
Yeah.
Okay. Okay. So I think we are done with your 15 minutes.
Yeah.
Okay. So
Thank you.
okay.
I like this topic.
Really.
Yeah.
Tomorrow we're going to have ECG. You know what ECG is?
Echo.
And it's
No,
actually not.
electrocardiograma.
Yeah, yeah.
Yeah.
That
I
is
see this topic last year. It's very very complicated,
yeah.
but I studied this topic uh, once, and I like this topic too.
Okay.
The echo.
Okay. So we're going to see it tomorrow. So you're going to tell us a little bit about what you read. Okay.
Okay.
Okay. So I'll see you at the end of the class, please, for the survey.
Okay. Thank you.
Okay. Thank you. See you later.
See you.
Hey, Mariana, how are you doing?
Hello, I'm fine, thank you.
Okay. So from now on, we have your 15 minutes. So could you tell me a little bit are what kind of diseases would the X-rays be useful for, and why, and what would you expect to find?
Uh, well, X-rays can be used um, to um, different kinds of diseases, like in cardiology, also in fractures, to see how it looks. The lungs, uh, well, indeed, that could be a good.
Okay, you said, well, you just mentioned cardiology, right? How could
Yeah.
we use X-rays in cardiology?
Um, Well, to see the size of the heart, how it's shaped, or even if it's um, receiving blood. I'm not sure.
Okay. Do you know how does cardiogenic pulmonary edema look like?
Not really.
Do you know how this is formed in cardiac or heart failure?
I haven't seen that topic yet.
Okay. What about any other kind of specialty that you might like to talk about and you read about?
Well, I have seen a little bit about their respiratory system.
Okay. What did you read and how can you relate it to X-rays?
Um, well, I have seen most of it about uh, examination, and but in an external side because I'm a physical therapist, so all about the size or how is it the stern clavicles and
Okay.
the sounds that these are dividing, but a little bit that I have seen in X-rays are what you mentioned yesterday. That was um, a sign of the diaphragmatic angle, if I'm not wrong.
Okay, yes. Have you seen any kind of disease related to this gastrophrenic angle?
Well, just not. I haven't studied that topic. Just I know some of the signs that are seen. Like I don't know if I could say it in Spanish.
Okay. So your field is mostly related to some other specialty that would be orthopedics, right? Since you are going to
Mhm.
be a physical therapist. So
Mhm.
you're going to see a lot of x-rays, a lot
Mhm.
of x-rays. So could you tell me the densities, the x-ray densities?
Um, well, they were ears.
Okay. How does air
And
look like?
it's like soft and almost like dark
Yes.
density.
Okay, yeah. So any other? We have air. There's actually five, I think. Yeah.
Yeah, but I only remember two. The other one that is the complete opposite, that is metal.
Okay, awesome, great. So you're going to see a lot of metal structures when you when you when you see your patient's X-rays. And this is the opposite, right? The We have the radiolucent, which is the air, and the radiopaque, which is metal. And there are some other X-ray densities in the middle of those two. What would those be?
Hmm. Well, they were fluid and soft tissue.
Great,
And
fluid and soft tissue.
yes,
And what about the
and
other?
bone.
Okay. So, how would you recognize a fracture when you see one?
Uh, well, because um, when we see an X-ray, we would see that the continuity the uh, of the bone is interrupted.
Okay. So, actually, some, well, yesterday I showed you an ulnar fracture, right? However, this
Mm,
was really easy to recognize because
mm,
it was like two separate bones almost, right? However, there are some cases in which it's a little more difficult because we almost see like a regular, a normal bone. So, what do you have to look for in a patient with really tiny fracture? What do you have to look
mm,
for? You're not always going to get a dramatic fracture like three or four
mm.
pieces, right, of bone of one single bone. You might get to see a patient who's had a really tiny fracture, and what do you have to look for in those cases?
Wouldn't be that just a difference in the X-ray density?
Okay, when you have, are you seeing my screen right now? Not really. No.
Mm, well, I see that you're in a slide that says, what do we use this image study? Just
Okay. Um, okay. What about now?
no, it's looking the same.
Really? Uh,
Yes,
and,
it's
what
like
about now?
no, yes, yes,
Okay.
in person.
So this is on your right. You get a really, really dramatic fracture. It's like two separate pieces of bone, right? Right here. However, here we can see healthy bones. So you know that we already talked about the different kinds of bone according to its structure. We have the cortical bone, a spongy bone inside, right?
Mm,
So when we are trying to see any kind of fracture, as small as it might be, we have to look for the a cortical defect. So
mm,
the flat part of this bone, we will have to look very carefully so we do not have any kind of interruption in the cortical bone. So first we have to look for the cortical bone and see if there's any abnormality. Okay, so as a physical therapist, you're going to see a lot of healthy bones. However, since your patient might have any kind of disease, and in your case, this orthopedic patients, you always have to look for any interruption in the cortical bone. Okay.
mm.
Okay. What
Okay.
about ultrasound? What could you tell me about ultrasound?
Well, this is a tool to that help us in a lot of um, diseases, also used as treatment in some of them, depending on the type of ultrasound.
Okay. What kind of diseases? You're going to see some ultrasound studies also due
Mm,
to respiratory tract infections, or maybe, yes, mostly that, right? So, there is, I'm sorry, give me 1 second. I'm sorry, I'm kind of sick, so I'm sneezing all the time. Okay,
don't worry.
so you knew that there is actually pulmonary ultrasound, right?
Well, before yesterday's class, I didn't.
Okay, so when, for example, you're going to go a lot to the ICU unit, to the ICU, and those patients, they almost all of those kind of patient, that kind of patient, have pulmonary secretions. So how can we notice if we have an ultrasound equipment available? Because most ICUs have their own ultrasound. They do not need to ask for anybody to come to the ICU. They just use it whenever they want to. So you're going to see a lot of patients with any kind of pulmonary disease. So we can get to see, for example, when we have pleural effusion. Do you remember what the pleural effusion is?
Um, was a derrame pleural.
Great. So, how could you relate it to your profession?
Mm, I don't really know about.
Okay. Do you know any kind of disease that might be related to your profession and ultrasound?
Um, well, it could be pneumonia
Okay, pneumonia. Great.
because of the secretions that the disease caused in the patient that has it.
Okay, and how would you help your patient? What would the treatment be?
Well, mm, it, in my hands, it could be the we we can help the patient to eliminate excretions that the disease causes.
Okay, and I always wanted to know how you do it. I mean, I always just saw the physical therapist go to and go into our go to towards our patient, but I didn't really know how they did it. Could you explain me a little?
Well, I only know yet the um I don't know how to say it in Spanish. Um, traditional way that they did it before. It
Okay,
was because it's a tool that is called clapping. The patient is I totally forgot how it's called. Uh, the cubito prono.
okay, prone.
Um,
Okay, go prone. Okay,
and with our hands, uh, we do the shape as we would be begging or praying to someone, and
okay,
we start like hitting the patient's back, but in the surface that we know that are the lungs. In that way, we make the molecules or excretions that are in the lungs can be eliminated by the own patients. But this way is not longer used because we can cause a lot damage in the vessels and some other complication more, but I don't remember the other one.
okay. So you were telling me about opposition, right? I don't know if I'm wrong. In Spanish, would be plegaria maometana. That one, right?
I don't know that
Uh,
position.
okay, so because I remembered what you told me because of some other disease that is pancreatitis. They usually have a really bad stomach ache, and this pain, well, it's reduces when they go prone and they take this position, plegaria maometana. it's like they're praying with their thighs touching the patient's chest. Is that the position?
Not really. I don't know. I said the wrong position, even in Spanish.
Okay, so you're going to look for it and tell me tomorrow, okay?
I know that in Spanish is the cubito pro, no?
Okay, to go
Just
prone, like the tummy down, right?
yeah, the tummy down, not the knees are not near stomach or just
Ah,
that.
okay. Okay, great, interesting. Okay, so we are done with your 15 minutes, and I'll see you at the end of the class, please, for the survey, okay?
Okay,
Okay,
thank
thank you.
you.
I'll see you later.
Welcome.
Hi,
Hello, Marcela. How are you doing?
I'm fine. And you? How are you?
I'm fine. I'm really not that fine. I'm sick. I'm
Oh
sneezing all the time. I think I get COVID again. It would be the third time.
my God, we're in the same boat because I feel the same.
Really?
Yes. Well, my aunt got the what? It got positive on COVID.
Sorry to hear that. And did you go to, well, did you have contact with her these days?
Actually, no, but she came here when for Christmas, so we had some contact. And a few days later, she told me that she was sick, and also her husband.
And
So
you're not feeling well now.
not at all. I hope it's not COVID, but I have like this little thinking on my mind that it could be.
Yeah, it's really it's awful being this way when you do not actually know what you're sick with, right? You're not sure if you got a simple flu or you just got COVID. Did you get COVID yet?
The test.
No, the disease before this one that could be possible.
At the beginning with my mom, we felt a little bit sick, but we didn't try to make the test because we didn't want it to get out the house first of all because it was just her and I.
Okay, so you don't really know if you got it before.
Uh-huh.
Okay, I actually got it two times at the hospital, and this would be the third time if it's positive. So I hope we both get better.
Yeah.
Okay, so yesterday we were talking about two important imaging studies, which were X-rays and ultrasound. Which one would you like to talk about?
Uh, I'm a little bit more interested about X-ray because I think it's a little bit crazy how it was created. I don't know if you get me.
Yeah, it's kind of interesting, right? Because it's like it was like a mistake. He didn't expect to find out what X-rays were. So, and he just it was like a coincidence. It
Mhm.
made him
You
win
know,
a Nobel Prize.
I heard a time ago that at the beginning people were using these X-rays to see the size of the feet, and they were constantly using the X-rays for this purpose.
And that they didn't know it was harmful, right?
Yeah.
So they kept doing it and doing it and doing it until, well, they must have had some collateral effects, right? So, okay, could you tell me, or what do you find interesting about X-rays?
Uh, um,
Well, I think it's well, as I told you this, first of all, that people were using this as something, as it was a photograph or something like that,
Yeah,
and they didn't knew the damage it could produce on someone. So
yeah,
it was a little bit, well, in science sometimes it's about mistakes.
yeah. And they kept doing it, right? And okay, and what about the use in our days? How?
Nowadays, I know this is used. For example, if I want to see, well, I use braces. So
Okay,
my doctor took me a X-ray to see the how my teeth are located and how the process will be to make them to see good.
okay. And so, for how long have you been using braces?
Well, I used braces time ago, but and I finished my process, but I didn't use all the times this
Oh,
retenedor. I don't know how
okay,
it.
yeah, yeah, yeah. At the well, when you go to sleep, you put them on. You put it on, right? And when you wake up, you do not use it anymore. Is that how it's used?
Yes, that one. So I hadn't finished like well my feet start moving because muelas de juicio. I forgot how to say this word.
Okay. Okay, I actually don't know about this term. I'm going to look for it.
Las molares creo que son.
Yeah, the last one, right? The
Yeah,
ones that appear when you're an adolescent or young adult, right?
yeah.
Okay, I'm going to look for it. I actually do not know how they call it.
Well, here in El Salvador we say muelas del juicio.
Yes, actually here also, but I don't know how they're called in English.
Oh. So
Okay, so any other use about X-rays in our days?
most commonly, I think there, well, because it's less expensive than other type of studies, it's used, for example, if I broke my arm to see how it's the fracture.
Okay, yes, for orthopedics, right?
Yes.
Okay, I just found that muelas del juicio in English would be wisdom teeth.
Wisdom.
Wisdom. Wisdom is like sabiduría, right? Wisdom. So it's kind of weird, right? Wisdom teeth. How that's how they call it. Okay, and what about any other kind of specialty that might use X-rays in any kind
Um,
of pathology or disease besides orthopedics and odontology?
uh, let me think. I don't. Well, for example, nowadays it's used to see the lungs of people with COVID. To see
Yeah.
how it's the thorax anatomy.
Okay, great. So for what would this especially be called?
Um, no, cardiothoracic, I think.
Pneumology, maybe?
Oh, yes.
Okay. Actually, I've read that they do call it pneumology. However, they also call it another way, which is pulmonology. Yeah,
Mm,
it's kind of weird. So pneumology, okay, to see the lungs, right, and the airways, the lower airways. Any other use for this kind of imaging study?
Um, I don't know. I'm not pretty sure. But well, it can no. I forget it. I think those are the only that I know.
Okay, and what about ultrasound?
Ultrasounds. These are this type of imaging are used, for example, The most commonly I know it's when a woman is pregnant to see the baby inside her
Yeah.
body.
Okay, great. And what specialty would that be?
Gynecologist.
Uh, okay, gynecology is actually for women who are not pregnant, right?
Ah,
The disease in non-pregnant women. And what about when they are pregnant?
I don't know if I'm good on the pronunciation, but I think it's obstetricians.
Okay, great. That is the name of the specialist, right? And the name of the specialty is obstetrics.
Obstetrics.
Obst-
This is a little hard.
kind of difficult.
Yeah.
And okay, so the whole specialty is called gynecology, and obstetrics. Okay.
And I remember I saw this on Grey's Anatomy, so I don't know how it could be useful. But when to see if someone has a yeah like can I say it in Spanish because I don't find the words in English.
Okay.
A ver si alguna extremidad de una persona tiene pulso. Si ha tenido una herida de gravedad que sea súper
Ah,
fuerte.
okay. That would be the Doppler ultrasound, right?
Yes,
Okay. So the Doppler. Do you know what the Doppler effect is?
the doctor effect, it's when, well, I heard that is when someone feels like, well, if I'm normal actually, and then I am in front of a doctor, I feel anxious and start feeling sick. Isn't that?
The Doppler effect?
Mhm.
Not really. It's,
Oh,
let's say you are in you're laying on your bed, okay, and you hear a motorcycle very very far, and you are not seeing the motorcycle, but you can hear it, and you can feel it's getting closer to your house by the sound. So the you actually can recognize when it is going next to your house, right? Because of the sound it is making. And then the sound starts to disappear, gets like it is not loud anymore. You can still hear it, but it is not loud anymore. So the perception that you get when a sound, the source of a sound is getting closer to you, you are listening to it, and it gets louder and louder and louder when it gets closer to you, right? And when it goes away, you can still hear it, but it's not loud anymore. That is the Doppler effect. So when we use this concept on medicine, we have this transducer, which is one part of the equipment that is with, I mean, with this transducer, we get is one part of the equipment related to ultrasound. So we put the transducer in one limb, as you told me, and we can see the blood flow. And that is how we know if there is like um, a vascular damage in a person who's had, for example, a fracture. For example, we get a humerus fracture in our humerus, right? Like the bone inside our arms, right? And as I told you in some other class, one of the first things you have to do as a doctor is check for the distal pulses. So
yeah.
to know if the broken bone has damaged any kind of blood vessel in the arm, you check the pulse in the wrist, the radial pulse. So that would be an example of how we can use the Doppler effect and the Doppler ultrasound to see if there is a still pulse in that limb that has suffered any kind of damage, for example, and mainly a fracture. I'm going to, um, I think you're very interested in this kind of stuff. So let me stop the recording. Brisa Montoya, are you here? Hello, Brisa, are you here?
Yes, I am. Good night.
Hey, how are you doing, Brisa? I thought you left.
No, I was having a little problem with the connection.
Oh, but you fixed it, right?
Yes, I hope it doesn't have any problem.
Okay, great. So from now on, we have 15 minutes, okay? So yesterday we were talking about some imaging studies, and we mainly talked about two, right? Which were X-rays and ultrasound. Which one would you like to talk about?
I feel more comfortable with the X-ray, I think.
Okay, X-rays. So, could you tell me about X-rays? How they are used? What use they might have when talking about some specific specialty or disease? Could you tell me a little bit about what you know about X-rays?
Yes. X-rays are a type of radiation that use electromagnetic waves, and the X-ray images shows the inside body in different tones and in black and white. And it is because the different types of tissues that we have, like for example, the bones, because of the calcium, they absorb more of these X-rays, so they are in white color. And because of all the fat and other tissues, they absorb less X-rays, and they are gray color. And the air, for example, it absorbs less quantity of the X-ray, so that's why the lungs are showing black.
Great. Yes. So you just talked about X-ray densities, right? We have some different densities, which are you already told me about air density, fluids, and soft tissue, bones, and there is one more left that you did not mention. Which one was it?
Oh, I'm not sure.
What about when I have a fracture and I have to get some kind of material to join the parts of the broken bone? Actually, I do have, well, about, I think it was almost 4 years ago. I had a fracture in my hand actually, and I have this material in my hand because I broke two metacarpal bones. In one of them, I have this material, and as you were telling me, the bones, since they have calcium, right? We can see bones in an X-ray in, let's say, gray to white color, right? And how would we see the material I have in my hand in an X-ray? That would be the next X-ray density.
You mean when there is an injection to a contrast injection, I think.
Okay, we're talking about X-ray densities. There are mainly four, right? You just told me about air, soft tissue and fluids, bone, and metal, right?
Yes, I did.
Okay, sorry, I didn't hear it. So we have this four main densities. So that's when we're talking about orthopedics, right? And do you know any other specialty that X-rays might be useful for?
Uh, sorry. They are useful for the dentist too.
Okay, the odontologist, right, and the dentist. Okay. Any other that might be more related to medicine?
To see the abdomen, to see the chest, to see the bones and feet too.
Okay, so what about the chest? You mentioned the chest. So what structures would you expect to see when we have posterior anterior chest X-ray or thorax X-ray?
The spinal cord, the lungs too. Um, that the bones that are there.
Okay, what else? You already told me the heart, right? Heart, lungs, the spine,
Yeah,
the ribs, maybe. What about the lower part of an chest X-ray? What
the
would you see?
kidneys.
Not really. The diaphragm, maybe.
Yeah, I think.
Okay. What else would you see? Let's talk about. Did you read about the cardiac silhouette in an X-ray? Cardiac silhouette.
Sorry, I having problems with the microphone.
Okay.
What was the question?
Did you ever read or heard anything about the cardiac silhouette in Spanish, silueta cardíaca, in an X-ray?
Mm, well, the X-ray shows like the contour of the cardiac silhouette, and it's a form of the structures that um, look that are señalan. I don't know how to say that in the image on the right part.
And what structures, or what cardiac structures would you see in an X-ray? Yeah, well, we're talking about cardiac silhouette, right? So, what structures are seen in a cardiac silhouette in an X-ray?
Oh, can I say it in Spanish?
I don't know. Maybe if you use Spanish, then you are going to say it in English anyway.
Okay, I will try. The
Okay.
superior cave vessel.
Uh, La vena cava?
Nah,
We already talked about it. How do you call this structure? Superior vena cava. Okay. Okay, the
okay.
superior vena cava. What else?
Mm, aurícula derecha.
We already talked about it also. How do you call this structure?
I don't remember.
No, that means I'm a lousy teacher. We talked about it a lot of times. I even made you repeat it. It was right atrium, right?
Okay.
I hope you don't forget it this time. So it's the right atrium. Okay, what else?
The right ventricle.
Actually, on an X-ray, we do not see the right ventricle. We do not get to see the right ventricle that well. Any other structure in the cardiac silhouette?
Maybe the left atrium.
Could be. However, we actually see the right ventricle, right? And above the right ventricle, what structure can we find?
The pulmonary artery.
Okay. And above this one, we have a knob. Do you remember? I I'm going to see if you pay attention in class. Yesterday I gave you an example of what a knob was. KNOB. Do you remember what it was? A knob in Spanish?
No.
You're not paying attention when I talk. So a knob is actually in Spanish el pomo de una puerta, lo que giras para abrir la puerta, el pomo. So a knob, the door knob is that part of the door when you turn it to open a door. That is a knob. In Spanish, we have el botón aórtico, right? However, in English would be the aortic knob, okay? That is how we call it in English, the aortic knob. Okay, and is there any other structure we might see next to on both sides of the cardiac silhouette?
No, I don't think so. Or I don't remember.
Okay, right next, on both sides of the cardiac silhouette, we can see the hilum, the pulmonary hilum. Do you remember the hilum?
No, what does it mean in Spanish?
Okay, ilio pulmonar, pulmonary hilum, ilio. A lot of organs have hilum, right? Like kidneys, liver, lungs.
Oh yeah, I know what a pulmonary hilum is.
Yes, that is how you call it. Okay, so what structures can we find in in the pulmonary hilum?
I remember the pulmonary artery.
Great.
The pulmonary veins too.
Okay, and
The bronchus.
yes. So, what year are you in medicine? You're a med student, right?
Yeah, and fourth.
Okay, you're here in Bolivia?
Yes, I am.
Okay, so you already had pneumology, right?
Yes, I did.
Okay, so let me ask a few things about pneumology. Let's see. What findings can we get in a patient with CPOD?
What is CPD?
Yesterday I already told you guys. Come on. Chronic pulmonary obstructive disease. EPOC, right?
Oh, you mean the symptoms that we can find?
No, not really. The findings on an X-ray.
Oh, in an X-ray. Well, there is emphysema.
Okay. And how can we find emphysema? That is how we call it. Emphysema. Okay. So how can you say you can see some emphysema on an X-ray? How are the findings? What are the findings?
Well, you can find emphysema and bronchitis too.
Okay. Yes, there are mainly two types, right? Of enfisema. There's in Spanish, centrolobulillar y el paralobulillar, right? So what is the main difference there?
Oh, maybe you can see more I don't know how to say that.
Sorry, I didn't hear completely.
Maybe you mean the hiperclaridad, like is more clear, is clearer than the normal.
Like it's like darker, right? Actually, because there is trap there in the peripheral lung area, so it actually gets darker because there is trap there. So that would be one sign. What about? Have you ever read about uh, what is this enzyme called? Deficiencia de alpha 1 antitripsina. Have you read about it?
Um, I think it's an affection when the body doesn't produce enough quantity. Oh, and the proteins just protects the damage in the lungs and in the liver, I think.
Yeah, great, awesome, yes, and yes, there's actually a person who develops CPOD, right? A young person who develops CPOD, a non-smoker patient, and with some liver problems, you might have to think about this deficiency, right?
Yes, I think you can diagnose cirrhosis too with that.
Yeah, yeah. I mean, those the liver enzymes are increased, especially in Spanish, transferasas, right? An elevation of those enzymes combined with CPOD in a patient with no history of smoking and a young person that is healthy apart from this disease, you might have to think about this kind of disease. Okay, yeah, you do know about pneumology. So we completed our 15 minutes and I'll see you at the end of the class, okay? For the survey.
Okay, thank you.
Okay, see you later. Bernardo, are you here?
Yes, sorry, doctor. I gave the computer to my brother because it's very slow.
Okay, don't worry about it. Okay, it's understandable. So from now on, we have your 15 minutes, okay? Yesterday, we were talking about two imaging studies, which were X-rays and ultrasound. Which one would you like to talk about?
Mm, The X-ray.
Okay, so X-rays. Uh, what could you tell me about X-rays? What they are used for, and anything you might know about X-rays?
Yep. It's a study of imaging.
Okay, it's an imaging
Um,
study. Okay, and what is it used for in different specialties?
uh, More than all this for traumatism, um, and to see the bones and the heart and the sorry, um, and
Okay, you just told me that it's used to see bones, right? In orthopedics, okay? That is the specialty, orthopedics. So, besides orthopedics, what else would these X-rays would be useful for?
uh, to see the heart.
Okay, and what would you expect to find in a patient with heart failure?
Uh, the heart is more is is big, more big or bigger.
Bigger, okay, bigger than usual, right?
Yeah.
And what about you're a senior student, right? It's your last year, I guess.
Yes.
Okay, so you're going to tell me a little bit about cardiogenic pulmonary edema.
Okay.
Okay, what is it like and how can you see it on an X-ray?
Um, could you say in Spanish because I don't speak?
Okay, but you're going to explain it in English, please, okay?
Okay.
Edema pulmonar cardiogénico.
Uh,
Cardiogenic pulmonary edema.
it's caused for cardiac failure. Uh, then the the blood stay in the lung. So the sorry, I am nervous.
Don't worry about it. Don't be nervous. I mean, there's only the two of us.
Yeah.
Okay, go on. Bernardo, you just left again, or are you still here?
I still here. So
Okay. How can you tell this patient that you might have has cardiogenic pulmonary edema? How does it look like?
uh, he can breathe well, very well, and he when he try to sleep, he can because uh, the liquid on her lungs uh, go.
Okay, and on an X-ray, how would you describe pulmonary edema, a cardiogenic pulmonary edema on an X-ray?
We can look the Elise Damaso sign.
That is actually for
A
pleural effusion.
The vessels are more bigger than usual.
Have you ever read about the butterfly sign or the bat sign?
No, but I think is how how we see the vessels, the rejects.
Okay, we actually see the edema, the liquid inside the lungs, right? And since it is actually affecting both sides, I mean both lungs, we see it as bat's wings. Okay, on both sides, we can see the liquid inside the lungs. And since we have two, we have like the wings of a bat or a butterfly. That is the butterfly sign or the bat sign. Okay, that is how we can tell this is a pulmonary cardiogenic pulmonary edema, because we also have an pulmonary edema that only affects one side. If it affects both sides, we can talk about pulmonary edema that is caused by a cardiac failure. Okay, so besides cardiology, is there any other specialty that might be related or might be useful, or x-rays might be useful for, besides orthopedics that you already told me in cardiology?
Gastroenterology.
Okay, and what kind of study would you ask for while talking about an x-ray?
Mm, other what?
Okay, you just told me gastroenterology, right? And in what kind of disease would you ask for an x-ray when we're talking about gastroenterology?
Yesterday we talked to the COPD.
That is okay, EPOC in Spanish, right?
Uh,
In Spanish, COPD, as chronic obstructive pulmonary disease, is enfermedad pulmonar obstructiva crónica. That is for pneumology, right? So, do you want to talk about gastroenterology or pneumology?
sorry, I read bad. We can see obstructions of the intestines.
Okay, great. What kind of signs would you find in bowel obstruction?
I don't know how to say it in English, pero la pila de monedas.
Great, awesome. Okay, the coin pile would be okay. So what else?
We can see a grow of the intestine in some part of there, and and y de la nada que se vuelva pequeño. It's a bad rotation.
Okay, great. Yes, we can see that also. Okay, in gastroenterology. So is there any other specialty that you could ask for any kind of a study related to X-rays? Okay, let's talk about the other study that we were talking about yesterday, which was ultrasound. What could you tell me about ultrasound?
It's very used in some different special piece. Uh,
Okay,
uh, sorry, what?
such as you just told me it could be used in a lot of specialties, right? Such as, like in Spanish would be como ser. Which one?
Emergency, we can make the faster. I don't remember the name, but it's in the abdomen. Uh, we see everything very fast to see if damage there.
Okay, in the emergency department, right? And what about a patient who's had some internal bleeding, and you are on your shift? And what would you look for? Well, when as we were talking about ultrasound, how would you use your ultrasound to determine if this patient has an hypovolemic shock?
We see a shade maybe, and we don't see very well the organ.
What about the inferior vena cava? Have you ever read about anything about hypovolemic shock and the diameter of the inferior vena cava?
No.
Okay, when a patient is bleeding out, okay, um, is losing blood, right? So the inferior vena cava has a certain diameter, and when this patient is losing too much blood, we can see an inferior vena cava that is flattened, more flat than usual, flattened. Okay, so it gets flat because the patient is losing blood. So when you have this kind of patient, you can use your ultrasound to see if this patient is actually bleeding out too much. If as you know, you can use the ultrasound to measure things, right? You measure in centimeters or even millimeters. So when you reach the inferior vena cava, you can determine how big it is, what the diameters are, and you can determine if this patient is developing on is bleeding too much, is bleeding out, and is losing too much blood, according to the diameter of the inferior vena cava. That is one very interesting use for ultrasound in emergency department. Any other that you might know about?
To see stones on the kidneys and the uh, gallbladder.
Okay, great. Yes, so these stones, right? In when they are inside of the gallbladder, they are called gallstones. Okay, you have the gallbladder, and if there is a stone, as you said, it is called a gallstone. Okay, so yes, we use it maybe in the emergency department when we're suspecting of a pancreatitis, right? Because the most usual cause of pancreatitis is an obstructive pancreatitis in which gallstone migrates from inside of the gallbladder into the biliary ducts, right? Okay, and yeah, we are done with your 15 minutes now. Could you wait so everybody joins back and do the survey, please?
Okay,
Okay, thank you.
thanks.
So, guys, we're down. We're done with today's class. You're only one, two, three, four, five people. I don't know why the rest of you didn't are not showing up in our meetings. However, we must go on. The show must go on. So let's get started with the survey. Please let me know when you're done. You know how it works.
I'm done.
Okay, thank you. Okay, I think you're all done. Okay, I think you're all done. So, guys, tomorrow, as you know, we have our theoretical class, and we're going to be talking about some kind of extensive topic, which is ECG. So, if you read, if you can read a little bit about it, would be much appreciated. So, have a good night's sleep, and I'll see you tomorrow. Okay. Okay. See you tomorrow, guys. Bye.
Bye.